The central nervous system contains 3 different dopamine tracts, including the mesolimbic and mesocortical, which affects the thought and mood. The tuberoinfundibular, which affects the release of the prolactin from the pituitary gland, and then the nigrostriatal, which affects the extrapyramidal motor movement. So patients with Parkinson's disease have decreased activity of the dopaminergic neuron in the nigrostriatal tracts, while patients with schizophrenia have increased activity of the dopamine in the mesolimbic and mesocortical tracts. Now in this video, I would like to focus on the Parkinson's disease, where the patients present with the loss of dopamine in the substantia nigra, and the onset of the disease is usually after the age of 50. So the diagnosis for Parkinson's disease is strictly clinical, but then if you obtain the biopsy of the brain of these patients, you will see that there are also Lewy bodies that are present. So patients with Parkinson's disease generally present with the tetrad of ataxia, where there is postural instability. They present with the bradykinesia, where there is slowed movement. They present with cogwheel rigidity. So on examination, while trying to move the limbs of these patients, you will notice that there is a pattern of resistance and relaxation, and thus this is referred to as cogwheel rigidity. And then finally, these patients present with resting tremor. And then, as the name implies, this tremor is present when the patient is resting, while it goes away when the patient tries to perform tasks or grab onto an object. And then there is this other condition called shy dragger syndrome, where there is a Parkinson's symptoms in addition to autonomic insufficiency, such as sweating, constipation, and orthostatic hypotension. Next, I would like to go over the mechanism of action of the Parkinson medications, which are directed at either inhibiting the acetylcholine or increasing the dopamine activity. So I should also mention that in addition to the decreased activity of the dopamine in patients with the Parkinson's disease, there is also uninhibited acetylcholine activity, and thus this is what is causing the rigidity and tremor, and thus some of the medications are directed at inhibiting the acetylcholine. Now here is the pathway of the catecholamine synthesis. Phenylalanine converts to tyrosine, which converts to DOPA, and then DOPA converts to dopamine by the decarboxylase enzyme, and then dopamine converts to norepinephrine, and then later on norepinephrine converts to epinephrine. Now the best medication that is used for the treatment of Parkinson is a combination of L-DOPA and Carbidopa. So L-DOPA will cross the blood-brain barrier, and inside the brain via the decarboxylase enzyme it converts to dopamine. And then in addition, Carbidopa is added to this medication because Carbidopa inhibits the peripheral conversion of DOPA into dopamine. So Carbidopa inhibits the DOPA decarboxylase enzyme. And by doing that, there is more efficiency of the L-DOPA reaching the brain and inducing its effects. So now that I've covered the mechanism of these medications, let's go through the list that I've provided here. So L-DOPA and Carbidopa, this is the first-line treatment for patients with Parkinson's disease. L-DOPA is capable of crossing the blood-brain barrier, and then inside the brain by the DOPA decarboxylase, it converts into the dopamine. And then this medication is co-supplemented with the Carbidopa, and the reason for that is that Carbidopa prevents the peripheral conversion of the L-DOPA by blocking the DOPA decarboxylase enzyme. And thus there would be the increased bioavailability of the drug to the brain, in addition to the decreased peripheral side effects. The next group of medications are dopamine agonists, which are listed here, and then amantadine increases dopamine release. In addition, it's an antiviral that is effective against influenza type A. So notice that amantadine increases the dopamine release as well as inhibiting the influenza type A, not type B, type A. And the way it works is that it prevents the uncoating of the virus. The next medication is selegiline, which inhibits the monoamine oxidase B, which preferentially metabolizes the dopamine. And then the entacapone and the tolcapone will inhibit the catechol-O-methyltransferase, and thus it prevents the degradation of the L-DOPA. Now, in addition, I mentioned that patients with Parkinson's disease have increased activity of the acetylcholine, and thus the anticholinergic medications are also used to treat the tremors and rigidity in these patients. So benztropine and trihexyphenidyl, which as antimuscarinic agents, can be used to treat resting tremor or cogwheel rigidity, but it's not effective against bradykinesia. So for bradykinesia, you will have to directly address the loss of the dopamine in these patients. And that concludes our discussion.